Hi PSA members. Our Federal Minister for Health and Aged Care, Minister Mark Butler, has now confirmed early negotiation of the 8th Community Pharmacy Agreement. Whilst the 8th CPA may be a tool to help us deliver meaningful reinvestment to address the current 630 dispensing policy, we must ensure that there is close alignment between the implementation of the 630 dispensing policy and the rollout of the 8th CPA to maintain the short-term viability of the community pharmacy network. So what I'm expecting is in the next 2 to 3 months, there will be a lot of discussions and a lot of work in the background in relation to the negotiations of the 8th CPA. The 8th CPA is essentially a scope of practice agreement, and that's the way how we see it. Because the two important elements that we need to ensure that the 8th CPA deliver is number one, around access to care, and secondly, around medicine safety. PSA has long championed for embedding quality and safety measures into programs. So what we're hoping to achieve through the 8th CPA is that there are quality and safety measures to ensure that we can provide evidence that the work that we do as pharmacists and the services that we provide can be measured and that it does help to deliver quality when it comes to the services. We know pharmacists are already doing a lot of services and a lot of programs out there, but often we're not paid and not remunerated. So what we do as pharmacists, all the way from minor ailments management, screening, triaging, referrals, to short, medium, long-term consultations, prescription modifications. All of these programs help us to deliver better access to care for Australians, as well as ensuring that Australians can continue to access safe and effective medicines and that medicines can continue to be used safely and effectively. So what we're hoping to achieve is through this 8th CPA negotiation is to cement the role of pharmacists as stewards of medicine safety and to help improve access to care by all Australians. We've also received some feedback from some members that there is a lot of efforts that needs to go into behind the scene to ensure that every pharmacy and every pharmacist are looked after. And this includes those in the MMM 5 to 7 pharmacies that are often overlooked in the whole process of negotiation. We must ensure that the core role of pharmacists and how we are integrated into primary care is looked after. Amongst all of this, the Minister has also made a commitment that he wants to see pharmacists better integrated into primary care. And we know that we have an aging population who are using a lot of medications at the moment. And we know that when medications are used, there is a risk for medication misadventure. And therefore, there is always going to be a need for pharmacists, whether you're a community pharmacist, a hospital pharmacist, or accredited independent pharmacist providing complex medication management reviews. We want to make sure that all of our members, regardless of where your areas of specialties are, that you will be looked after as well. And finally, can I just say that this is going to be a very challenging time for our entire profession. It is very critical for all of us as one profession to move in the one direction, in the same direction. So please continue to support each other and look after everyone around you. And if you have any recommendations or any advice, please feel free to contact us as we navigate through this process. Thank you.